Mr. Moore, could you talk a little bit about, you chose to do your sperm banking sort of external to where you got your transplant, right? Could you talk a little bit about how you identified where you were going to do your sperm banking and the logistics of that?
Well, me and my wife did a little bit of research on, where we would like to preserve at. So we came to the conclusion we wanted to choose a company. They're located in Arizona. And roughly we did the thing where, do we want to have one more child? Do we want to have two more? So, that number just constantly keeps changing, but we had a set number that we would like to be at for the future. And that's how we came to that conclusion. Totally, we decided to save 2 vials. So that'd be 2 kids we could have in the future. And roughly it was about 1,100 altogether. They preserve these vials for 10 years, I believe.
Great. And so for clarity, you don't pay a monthly or an annual fee to keep your sperm banked. You've paid for a 10-year upfront fee. Is that correct?
Yes.
Great. Ms. Station, would you be willing to talk a little bit? You also had a unique kind of fertility preservation experience because you were at NIH, right? Will you talk a little bit about that, the logistics of that with us, please?
Sure. So my experience working with NIH, I spoke with the different physicians there, and they were able to design a protocol to offer the fertility preservation. And so they worked with Walter Reed Hospital. I believe it's directly across the street from NIH. So the way that it worked is I was seeing the gynecologist at NIH and working with them, and the actual procedure where I needed to go in for the removal was done at Walter Reed Hospital. And so that banking place, at Walter Reed, is where my eggs were stored. And so initially it was about 3 years that was offered to me without any fee. And then after the 3-year period, I pay an annual fee to keep them frozen.
Terrific. Are there other things that have occurred to you that you think everyone should know?
Well, again, I can't express the joy and just the excitement of being cured, being able to get up in the morning and just cook breakfast and be there for my son. I like to spend pretty much all my time with him. My wife says he's getting a little spoiled, but I believe I earned that. So definitely, if you have the ability, if you have the resources, big thanks to Be the Match for granting sickle cell patients. Just please look into it. I understand having sickle cell is extremely difficult. A lot of patients don't think past, the pain, but you're going to get past the pain. You're going to have a life after transplant. Just make sure you preserve that life so that, you can have one with your family. It's a beautiful thing to be cured, but it's even better to be cured and then spend that time with your family.
We have a question in the chat that I wanted to put to both of you, which was that someone asked if you could talk a little bit about the condition of your health before you went through transplant, which, right, probably affects a little bit the extent to which you feel like you can go through something like fertility preservation. And the person is specifically asking about what treatments you were taking for sickle cell disease before you pursued fertility preservation and transplant.
So I will go first. I pursued hydroxyurea initially, but I didn't find that it was really working that well for me. And I would say going into my young adulthood is when my crisis would begin to occur more frequently and more major, and the length of time would become more. So I think, honestly, I had good pediatricians. I had good care overall, good health overall, no really outside conditions related to the sickle cell disease for my physical health. And I think that's one of the contributing factors that made me a really good candidate for the stem cell transplant. But coming up into the stem cell transplant in the process, my crises were a bit more heavy and severe and so forth. And then I also pursued like the transplant, the blood every month that you're receiving. Yes, thank you, Lydia. And so that was also a help for me as well, outside of the opioids.
Mr. Moore, you want to talk a little bit about what was going on with you before transplant?
Definitely. A big thank you to Dr. Pecker. I can't stress that enough. When I reached out to Dr. Pecker, I was going through, to say the least, chronic pain levels about 8, 9, 10. It was just all day. I was not able to really get up, make it to the bathroom, to be honest. My wife had to help me with that. It started roughly about 23. Within a time span, I'll give it 5 months, my health began to decline rapidly. I went from, working to I wasn't working anymore, to I had to be in the house most of the day, to, couldn't cook anymore. So I had to be in bed. So when I reached out to Dr. Pecker, I was definitely going through a rough time. I've tried hydroxyurea. It didn't work for me that well, not to make a meaningful difference. I was on Oxbryta as well. Had an allergic reaction to that medicine, so I was not able to stay on that long. When I reached out, it was a horrible time for me. Pain medicine constantly, it was around the clock, every 6 hours.
Thank you. There's one more question that maybe we could talk about a little bit, which is if you hadn't been able to bank sperm or eggs, how do you think you would have thought about your family building options, like in terms of adoption or sperm donors or egg donors? There are also people who want to know a little bit more about the details of your transplant. So they want to know about how old you are, and they also want to, and how old you were when you went through transplant, and they want to know if you had half match or full match donors. Do you think you could talk a little bit about that? And then we're going to wrap it up, and there will be more questions at the end. But if each of you could speak to some of those things, that'd be great.
So for me, I still feel like if I wasn't able to do egg preservation, the option of having a donor or adoption are still available to me. That's not off of the table for me, because extending the family is extending your love. So that's still an option. It would be different. However, there's a difference when a child comes from you and it's your bloodline. When I first started it, I believe I was 30 years old, maybe 31. And I am 36 now.
So. When I first started my transplant process, was 25. And when I finished, I'm 25. I'm actually 7 months out of transplant currently. And I feel like if I wasn't able to have, a child come from myself, I would definitely have looked into adopting. I feel like where we're getting at here is the biggest point I'm trying to make is when you live with sickle cell, you constantly have these limitations on your life. There's things that you can't do all the time. But when those limitations are taken away from you, I would like every patient to be able to live that full life. So whether that's adopting or whether that's banking, just to be able to spread that love, you being able to do the things that you love with the people that you love. That's the biggest part here.
All right, and so for our last comment that we're going to make, one of the things that has changed in the last 24 months, really, since the NHLBI Cure Sickle Cell guidelines came out, about what tests we should be doing before and after transplant for people with sickle cell disease. One of the things that those guidelines now say is that after transplant, you should be regularly assessed for your hormone function and for fertility. And someone asked if either of you have had your fertility reassessed since your transplant. And I want, or if either of you have tried to conceive either spontaneously, natural, without using your banked sperm or eggs, or with using them. Would you each be willing to briefly speak to that?
So my hormone levels, my fertility assessment has been routinely assessed and checked. And post-transplant, I did go through a phase of premenopause and so forth. Those hormone levels directly after transplant have subsided significantly given the time that has happened over the hormone interval assessments. So today, actually, I am about 3 years post, and my menstruation has recently returned while doing hormone replacement therapy. So that's just to give you a little, the longer the time from transplant, it is a possibility. Now, I have not tried to have any children since transplant, as in I'm just focusing on myself for right now.
Excellent, thank you so much.
My hormones levels have not been checked. I guess it's just hasn't been that time yet. I just received my vaccines 3 weeks ago, I believe. But we did order an extra vial just for after transplant. I wanted to see how many live specimens were in the vial when I mailed it back to my banking company.
And have you gotten the results yet? Can we ask you that nosy question?
Not yet. I haven't sent it in yet.
We'll be on the edge of our seats. Come back next year, right?
Yes.
So we're about at time. Thank you so much, Ms. Station and Mr. Moore, for sharing your experiences with